It's been a pleasure and a privilege to work with our commissioners at Isle of Wight Council and our partners across health, social care, education and the Job Centre Plus to develop an integrated early help service delivered through family centres here on the Isle of Wight. System change is never easy, but by building on and reinvesting in what we know already works and working together to a shared set of outcomes and aspirations, we have achieved positive and sustainable change here on the Isle of Wight. The Isle of Wight Family Centre offer, working together with the early help system, has promoted community capacity and cohesion and has supported the development of resilient families living within resilient communities.
What is a family centre hub? It's a point of contact for families. It's a source of information and guidance. It's a bit of a drop-in surgery on a good day. It's a provider of services, but it's also an enabler of services. It enables us to have opportunities to be innovative, to work in partnership, to test things out. It's about taking a whole family approach, using tried and tested evidence-based programmes and approaches, being trauma informed in our practice, thinking about the whole family. It's multi-layered and it's multidisciplined. We took our children's centres and we involved them into family centres, so took a 0 to 19 approach, making sure that we were working with the whole family. And that means actually tackling those challenges with them and looking for ways that we can affect change and encourage them to develop and be the best parents that they can be. Taking a multi-layered approach means that we've got families coming in at a very universal level, so they're seeing the midwife, their health visitor, come into our stay and play, so we've got volunteers that are supporting their own community to offer services, so it's the community helping the community approach. And you know, that has meant that what the public see is actually something that's very welcoming, very approachable.
Hi, I'm a volunteer coordinator and I support volunteers that help us in the family hubs. They really are the heart of what we do because we couldn't do what we do without their regular support. They come in every week and they set up exciting things to do and play sessions for families with children aged 0 to 4. Some of the activities are things that the families wouldn't do at home, for example messy play or eating a wide variety of healthy fruit, and the families really value the fact that the volunteers give up their time for free to provide them with a safe space to come and play alongside their children. The volunteers are all trained to spot families that might need additional support and information, and they are able to signpost them on to either other members of staff or external providers so that they can get the help and support they need in a timely way. And it's all quite seamless really. The volunteers themselves are often parents who have benefited from additional support from the family hub, and it's their way of paying back. But this makes them very trustworthy and they're non-judgmental, and they treat all information confidentially, and this enables parents who may have found it hard to ask for help to ask and receive the support they need. Many of the volunteers have gone on to become members of the children and young people's workforce or to do additional learning and training, and they said that being a volunteer in the hubs gave them valuable insights and enabled them to gain those opportunities. But some of the volunteers just like to come every week and enjoy what they do and love being alongside the families and the children, and they know that they are providing a unique service to the community that they live in. And that's really why I love what I do.
I've been a volunteer for Barnardo's for just over 2 years now. I know these sessions make a difference to families as we offer a warm, safe and friendly environment for them and their children to play in. This is so important to families that they can come along and talk about their problems, and we are there to listen and be non-judgmental. We can also pass them on to any relevant Barnardo services they may need. The families tell me that their children enjoy coming along to the sessions, and some of them have grown in confidence in their speech and their social interaction with other children. They tell me what their children enjoy doing, which helps with our planning each week, and we offer feedback forms regularly so we know what we are doing is what they are enjoying.
What I've gained from being a volunteer at Barnardo's is, firstly, I've made some excellent friends, which is priceless. And also, I've done a couple of courses, to list a few. I've done a safeguarding course, and I've done a food safety course, which has enabled me to do the snacks at the sessions, which is excellent to see the children's faces when they're tucking into their snacks. Also, I did the safeguarding course, which has come in pretty useful actually with issues that may have arisen in my children's school. And in fact, I have brought safeguarding issues up to the head teacher at my children's primary school. So it's been very, very valuable for me, and I plan on doing as many courses as I can while I'm volunteering at Barnardo's. And I love volunteering at Barnardo's. And I plan on volunteering at Barnardo's for forever.
The best thing about being a Barnardo's Centre volunteer is the feeling that you're giving something back to the community. Volunteering can open many doors and opportunities and also make some really long-lasting friendships. Being a volunteer gave me the confidence to pursue a different career, and due to the dedication of the Isle of Wight volunteering team and training which I was offered, I decided to retrain, and I now have a career working directly with vulnerable children.
So how do you refer into the service? Well, you can come in as a self-referral, so you can walk in the door or you can make a phone call. We just fill in a very short form for you. That gets passed on to one of our fabulous targeted early help team, and they will give you a call. They'll have a chat with you on the phone, see what your needs are, see how we can help, and we go from there. So it might be that we refer on to another agency if it's around debt or housing, or it might just be actually that you would be supported with some strategies over the phone or a parenting programme. Alternatively, other agencies can refer in, so it might come from a health visitor, it might come from a GP or a paediatrician. It's a very similar form that they fill in. We wanted to make it super easy for agencies to come in and for families to access this service. So we have 5 to Thrive, which is brain development and communication, language builders, we have family links, which works on empathy and praise and appropriate expectations for our children. We have specialist programs, which are our Signet, our ASC and our ADHD programs. We have programs around health, and we also have programs for the older children, young people, around tricky, challenging behaviour. So we're super excited. I'm really pleased to be sharing this with you, and looking forward to the future. Thank you.
We have a team of 20 family support workers who work out of the family centre hubs, delivering family support within family homes across the island. Families can have from 9 months to a year of intensive family support within their homes as part of the programme. Families can be referred by a wide range of professionals, for example, schools, health professional, social worker, police officer, GP, housing support officer or work coach. Within our team, we have 2 project workers who respond to referrals from professionals who might not be in a position to complete a whole family assessment. For example, a police officer or a GP might not be in a position to complete an early help assessment. These workers go out, meet the family, complete a whole family assessment, and then that family can access the support that they need from our service. Referrals are received via a weekly triage meeting at which the outcomes for the family are identified. Families are allocated a family support worker who conducts an initial visit. They meet the family, talk to the family about the service. They share with the family the outcomes that have been identified for them from the assessment. They check out with the family if this is something that they want to be working towards, if there's anything else that hasn't been mentioned in the assessment that they really think is a priority for them as a family. But most importantly, they get sign up and agreement from the family that they really are in a position and this is the right time for them to make the positive changes that they want to. The worker then devises a whole family plan, which includes all members of the family. This is drawn up in conjunction with the family and with other professionals that might be working alongside the family, for example, schools, health visitors, other professionals. The plan is then reviewed every 3, 6, 9 or 12 months, dependent on how long the family need to receive the support for. All family support workers are highly trained and skilled parenting practitioners. They might work with families to establish morning routines, bedtime routines. They might enable them to access the specialist support services that they might need. For example, a parent might need to access specialist mental health support, and the worker will help them, will refer them, and they'll support them to access that service. They might deliver an accredited parenting programme on a one-to-one basis in the home. Workers might support the parent to attend meetings in schools, for example, and enable them to fully take part in the meeting that they might have been apprehensive about. With a family support worker by their side, they might feel more confident in accessing the meeting. They might refer the parent to our DWP worker, who can support them with accessing further training opportunities or progress to work, such as CV writing, or they may even facilitate them to get back into work if that's what they want to do. At the regular family plan reviews, families and the worker can see the progress that the family is making, and eventually they'll get to a point where they can start to see that they've achieved some of the outcomes that have been identified via the assessment. For example, they might be able to see that school attendance has started improving as a result of the morning routines running a lot more smoothly within the family home. As the worker nears the end of their support, they work with the family to close them to family support. So, for example, they might support them to access centre-based services at the family centre hub, like a parenting group, for example. The frequency and intensity of visits will begin to reduce, with the worker checking in on the family at regular intervals until they're ready to be closed. The service is embedded within early help, and it's very much about prevention of escalation to higher tier services. Our service demonstrates that early intervention at the right time for families is effective and can be successful.